I'm Dr. Neelam Khurana, a general pediatrician, here to discuss how children with learning disabilities can receive free support in public schools with an IEP or a 504. As a general pediatrician, it is our job to support our patients with disabilities, but if we weren't given the knowledge, it is difficult to support them. At the end of these slides, you should understand the key factors and differences of an IEP, a 504, and other forms of school support and assistance for children with learning disabilities. As many of you know, there are laws in place for children with disabilities through an IEP or a 504, but most of us have not been taught exactly what this means. These laws are crucial for those with disabilities to reach their full potential and allows them to participate in and contribute to our society. I will briefly break down the legal obligations schools have and children's educational and civil rights, then discuss the functional differences between IEP and a 504, what disabilities are included in these plans, and the process for students to receive appropriate support from their schools. There are laws in place that support citizens with disabilities. These laws are crucial for children with disabilities to reach their full potential. Section 504 of the Rehabilitation Act and the Individuals with Disabilities Education Act, or IDEA, emerged in the early 70s to protect children with disabilities. The IDEA is an education act, while Section 504 is a civil rights act. The difference between these two documents lies in their purpose and will become more clear as we proceed. The purpose of the IDEA is to provide federal funding and assistance for special education. The purpose of Section 504 is to prohibit discrimination in a program that is already receiving funds in any form from the federal government. FAPE is another federal law that states, quote, students with disabilities are entitled to a free, appropriate public education, regardless of the nature or severity of the person's disability, end quote. FAPE includes regular or special education, related aids and services to accommodate the unique needs of children with disabilities. FAPE is accessible from birth to 21 years, but we will focus on the 3 to 21 year range in this talk. As you can see, the age of the child determines the type of the support the public education agency will be providing the children. All of these programs are at no cost to the parent or the child. To be an appropriate education, students must have a plan that is designed to meet their individual needs, just like students without disabilities have a general curriculum for their needs to be met. To ensure that the public education is appropriate, the Public Education Agency, also known as PEA, should develop an individualized education plan or a 504 plan of accommodations for each student with a disability. So since IDEA, Section 504, and FAPE are all federal acts, the process to access support is the same in every state. The qualifications may differ per state for them to meet criteria to obtain the support, but we will go through that later. Let's look at the process for our preschool kiddos. If a child with known developmental delays is already receiving early intervention services, their program will end at 3 years of age. At this age, the early intervention program will have already helped the child transition into the public education program, also known as priority preschool. If the child is not already enrolled in an early intervention program for developmental delays, parents can still go to the school district to get an evaluation done as early as 32 months to determine if the child meets criteria to be placed in a priority preschool. They will start the preschool when they turn 3. Children that are already part of the early intervention program for their developmental delays will have to transition to a public education program, known as priority preschool, by 3 years of age in order to receive services from the state. Our patients will continue in the preschool setting until they are in kindergarten. At that time, the Public Education Agency, or PEA, will already have guidance in place for their transition to kindergarten. Priority preschools should be recommended for all children with developmental delays, as they will permit children to attend even if they are not potty trained. They usually have a teacher, 3 aides, and 8 to 12 children per classroom, so that is 1 adult for 2 to 3 children. They provide speech therapy, occupational therapy, and sometimes even have a sensory room for children to unwind. If a parent is interested, guide them to their local school district's website to take the next steps. Assistance during the preschool age is relatively easy to get if the child has significant enough delays. On the flip side, school-aged children receive support through either an IEP or a 504, which can become a much more complicated process. Just like in priority preschool, a full and individual evaluation is the first step to receiving support, but schools typically wait until about 2 months after school has started before referring a child for an evaluation. They need to get to know the child as well. But if your patient has severe behavioral concerns or developmental delays, it may be essential they receive school support as soon as possible. Encourage parents to reach out to their school district prior to entering kindergarten for an evaluation. If this child has significantly disruptive behaviors and the process does not start until after they enter school, it is going to be difficult for the child, parents, teachers, and other children in the classroom. However, this is not the case for all children. The child may have developed without any delays, but once they begin school or later on in the school years, it may become clear that your patient needs additional support at school. So, at this point, if the school has not already referred the child for an evaluation, the parents may request an evaluation. Parents can do this by writing a letter of request that includes the legal obligations of the school to act in a timely manner. If a request is not made in writing, it may be as if it never happened in some schools. So parents should document the date of the school receipt of letter and keep track of the progress. I will provide a sample letter with appropriate verbiage so you can help families complete the first step in this process. Additionally, a qualifying medical diagnosis can provide some means of school support, but schools should not ask parents to supply proof of a medical diagnosis to start an evaluation. By law, every child has the right to a full and individualized education plan at the request of the parents. Sadly, I have seen parents come into the office saying the school told me I need a diagnosis from you in order to get an evaluation in school. This is inaccurate and illegal. Public education agencies should be evaluating our patients to determine if there is a diagnosis warranting further school support. They determine the diagnosis when they do the IEP. There are times when your medical diagnosis is needed for a 504 and you know the child does not need an IEP, but most of the time your patient will need an evaluation first to determine their needs. Please inform your patients and parents of their rights. Let's briefly review these laws so you can have a better understanding moving forward. The IDEA federally funds special education. Section 504 prohibits discrimination within a federally funded program. FAPE entitles every child to a free and appropriate public education. Every child means any child from birth to 21 years with or without a disability, regardless of the type of disability. FAPE is accessed through a PEA, or Public Education Agency, who will administer an evaluation for the child to determine their eligibility to receive a full and individualized plan to meet their learning needs. Priority preschool is provided to eligible children aged 3 to 5, and an IEP or a 504 are provided to eligible school-aged children. So now let's compare an IEP versus a 504. What is the difference for our school-aged patients? An IEP is an individualized plan for a student's special education experience. Students with this plan must be taught differently than peers without disabilities by receiving separate specialized education. Versus a 504 outlines a plan of accommodations the school will provide the student. Students with this plan are taught in the same curriculum as their non-disabled peers, but are given accommodations to limit any barriers a disability may impose. An IEP is covered under the IDEA and provides special education to 13 disabilities, versus a 504 plan is covered under the Rehabilitation Act and supports any disability. But to receive either type of support, the child's disability should be interfering with their ability to learn in the general classroom. The difference is that children with an IEP require specialized instruction outside of the general classroom to meet their individual education needs, versus a 504 requires services and changes to the learning environment that will allow students to learn alongside their peers. They do not have to be pulled out of the classroom, but they have the option to do so if needed. This may be confusing now, but by the end of the discussion, the differences will become more clear. After a full and individual evaluation, schools will present parents with eligibility determination that decides the type of support a child will qualify for. IDEA has 13 supporting diagnoses. Specific learning disabilities such as reading impairment or dyslexia, math impairment or dyscalculia, written impairment or dysgraphia, other health impairment, under which ADHD can be categorized, autism spectrum disorder, emotional disturbance, speech or language impairment, deafness, visual impairment, including blindness, deafblindness, hearing impairment, intellectual disability, orthopedic impairment, under which cerebral palsy falls, traumatic brain injury, and multiple intellectual disabilities. Take note that schools do not fully evaluate for all of these diagnoses, nor does it mean that if the child has any of these diagnoses, they will meet IDEA diagnostic criteria to receive an IEP. So please advise parents to request specific testing if there is any concern for another underlying diagnosis that may impact the child's ability to reach their full potential. Let's look at an example of this. If you are worried about dyslexia, you can tell the parents you should ask for phonemic awareness testing, which comes in different forms such as the CTOP-2 or Woodcock-Johnson tests of achievement. If they do meet criteria for a diagnosis of dyslexia, the IEP diagnosis will state something like specific learning disability in reading or with reading impairment. If you're worried about autism, you can ask the parents to ask the schools to look at behavioral testing such as the BASC or Vineland, or you can ask them to do autism-specific testing like the ASRS or ADOS. Typically, they will do the ASRS, if anything. The ADOS is the gold standard for autism testing that we can use for our medical diagnosis. It is important for you to note that even if they have a diagnosis in the school evaluations, these do not meet criteria for a medical diagnosis, and many times the insurance or state-funded services will not accept a diagnosis that is provided through a school evaluation. Additional medical evaluations may be required, and most of the time you do not have the information that you need in the school evaluation reports to meet the criteria for an autism diagnosis. But many times you can meet the diagnosis criteria for dyslexia with the school evaluation.